many different ways. One way, obviously, is if we can beat the cost trend that's going on nationally. That helps provide benefits not only for the company but for our employees. Second of all, we look at the health dividend with regard to improving the overall population health of our employees. A healthier employee is a more productive employee, which provides a health dividend for the company. And also looking at satisfaction levels. We'd like to have engaged employees, and I think a health dividend really ties into that. If we can make them satisfied with what they're doing and they're healthy, then it's better for everybody. We've done a number of things that we think are pretty exciting. We've really taken a holistic approach to healthcare. So it not only involves looking at our plan design, giving employees more control and choice over their healthcare, but really providing support systems, giving them the tools to be more engaged consumers in the healthcare situation. Also providing them incentives to be involved in weight management programs or battling sedentary lifestyles. So it really involves a lot of different aspects, and I think we've tried to kind of hit all of them. The psychology of the employee, how they assess things, how they look at things are absolutely critical. Everything from looking at plan design and how you provide the choices to how you motivate them and engage them to be involved in healthier behaviors. One of the great motivators for people to get involved in healthy activities or get engaged is their coworkers. People work together, they have a friendly competition, they like to get out there and maybe walk together at lunch, maybe take on a challenge together with regard to weight management, weight loss programs. And we think that healthy competition and working together and collaboratively has been very good from a health standpoint, but it also has given us dividends as well in that people are connecting better with the workplace. Walking meetings, doing things over the lunch hour. There's been a lot of intangible benefits to this program, which really has enhanced our health dividend. We wanted to have something that was available to people that were already active. Maybe they were already a triathlete, but someone also a couch potato. So we did a number of entry points involved with participating in biometric screenings, involved with Weight Watchers, involved with walking program, gave additional entry points if somebody achieved 1 million or 2 million steps. So we had a lot of different entry points so that everybody could participate and enjoy it and enhance their health. So it was a lot of fun, and we put some very big ticket prizes up there to really incent employees to be involved, and including a brand new 2009 Saturn Sky convertible. We also wanted to have some challenge awards to underscore that we're all in this together, that the company and the health dividend really is achievable only if we all work together and pull together. So we really set some targets with regard to where we wanted to go, with regard to participation in our biometric screening program, and also attainment of health goals. And we said if we reach certain goals, we will give away the car, and it really did motivate people, and we did give away a car. Things we were looking at most specifically was to try to get higher participation in biometric screening, so get people actually to take ownership of their health. And then the second thing we were looking for was to try to get an improvement in our overall health index scores, or the percent that we had that are healthy. Also, we're looking for more people to get involved in the walking program or Weight Watchers that we instituted. So all those things really tied in to kind of group goals, became individual rewards in the end. One of the things we found in our research, which was kind of interesting, was that people are motivated most to get involved with health and wellness activities, not to just improve their health per se, but to look better and feel better. Some of the neuroeconomic research indicates that you've got to have very specific and vivid goals to motivate people. And obviously, putting a brand new convertible where you can see yourself on a bright sunny day, everyone visualizes the big prizes as the potential that they can win that prize. And I think the research would show that that's much more motivating in a lot of respects than the actual reward itself. For example, getting a $100 gift card. The fact that you've got a very, very big prize is just more motivating. But we actually provided everything that we did for about $10 per employee, which is pretty amazing when you think about it. So we gave a car away and a number of other big prizes, and when we amortized or spread that across our population of employees, it only worked out to be about $10 per head. So very, very low cost to the company, but the perceived value to the employees was very, very high, obviously, when they know that the prize is a brand new car. Well, I'm very fortunate, number one, that we have a very supportive senior management from the get-go. We've been very involved in employee programs for many, many years. So, quite frankly, it wasn't that tough a sell. But, again, visualization helps with regard to this. And you think about, what one heart bypass operation might cost the company. A brand new car really pales by comparison. So if we can avoid one heart bypass surgery by getting people more involved in their health, the price of a $30,000 automobile is a pretty small price to pay. So that logic seemed to work with senior management, and has also helped us explain why we were doing this to the employees, because no employee wants to think that their company's resources are being wasted either. What we found is that most employees don't understand basic insurance principles. They might understand sharing of risk with regard to a number of people buying insurance on their home or car, and that risk is spread over a wide population. And if you have the bad fortune to have a house fire or to get in a collision with your automobile, that risk is going to be spread. They don't seem to understand the same principles with regard to health care, that the facts are that most employees in any one year are going to have very, very low health expenses. By looking at their own situation and spreading risk with themselves over a course of a number of years, which you now can do through these account-based health plans, that really is still an insurance principle, but who would you rather share risk with, yourself or with a coworker? And that has been something that has a lot of resonance with our employees. Well, we've continued to grow our account-based enrollments, and today in our company we have a standard PPO product with a limited about $350 deductible, and we have an HRA and an HSA plan as our account-based options, and we're up to about 67% of our employees now enroll in the account-based plans, which is a very strong result, I think, when you have an optional program like we have. We're looking at every dime with regard to making sure that it's well spent, that our senior manager really came to us and said, can't we do another competition or another challenge like we did last year? So I think that speaks volumes with regard to the value the senior management has put in this program and the value we got out of it and the health dividend, in fact, we got out of it. So we are moving